Rational Emotive Behavior Therapy, also known as REBT, is a cognitive behavioral approach to managing mental health. It has been used for decades as an effective treatment for depression, anxiety, and other psychological disorders. REBT focuses on replacing negative thoughts with more adaptive ones to reduce emotional distress and improve overall well-being. REBT, formerly known as Rational Emotive Therapy, is a cognitive behavioral therapy developed by psychologist Albert Ellis in the 1950s. The central premise of REBT is that irrational beliefs lead to negative emotions and maladaptive behaviors. It believes individuals can achieve greater emotional and psychological well-being by challenging and replacing these irrational beliefs with rational ones. REBT is based on the ABC model, which stands for Activating Events, Beliefs, and Consequences. According to this model, events do not cause our emotional and behavioral reactions directly, but rather our beliefs about the events mediate this relationship. Therefore, our beliefs rather than the events themselves lead to our emotional and behavioral response. Ellis and McLaren suggests that in the initial phase of therapy, the therapist assists the client in recognizing their illogical beliefs and the resulting outcomes. Ultimately, the therapist helps the client adopt more rational beliefs through techniques like disputing, decatastrophizing, and humor. REBT is used to treat a wide range of emotional and behavioral problems such as depression, anxiety disorders, addiction, and relationship issues. You can also use this approach to increase your patient's self-esteem, develop healthier coping strategies, help patients overcome negative thinking patterns, and improve patients' communication skills. You can use many REBT techniques to help your client achieve the goals they have set out for themselves. Here are some of them. Reframing, which involves looking at a situation from a different perspective to change the meaning or interpretation of it. Decatastrophizing, which focuses on challenging and replacing catastrophic or extreme thoughts with more realistic ones. Role-playing, which helps the patient practice new behaviors or responses to situations that trigger negative emotions. Exposure therapy, which involves gradually exposing someone to the situation or object that triggers their fear or anxiety in a safe and controlled environment. Cognitive restructuring, which focuses on identifying and challenging negative thought patterns and replacing them with more positive and rational ones. Homework assignments, which involve practicing new skills or behaviors outside of therapy sessions. Rational emotive imagery, which involves imagining a situation that triggers negative emotions and practicing responding to it rationally and adaptively. Mindfulness, which involves practicing being present at the moment without judgment. Humor, which uses humor to challenge negative or irrational beliefs and reduce stress. And assertiveness training, which involves teaching your client how to express their needs and wants clearly and respectfully. To learn more about REBT and how it can be used in your practice, read our guides in our Carepatron platform, which you can find through the link in our description. Check out our guides playlist to learn more about topics similar to this. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.